All right, we're going to get started here. I want to start by thanking you all for coming here today. It's much easier to talk with everybody together and address your questions in person, so I appreciate your effort. I'm Dr. Kat McGraw. I'm the Chief Medical Officer here at the hospital and also the Chief Information Officer. We're going to hear from a couple of other folks here today as well. We have Meredith Burt. She's a nurse who is our infection preventionist. And we also have Taylor Wellington, who is our Director of Emergency Services, also a nurse. And a few other people who can assist in our questions and answer time if necessary. We'll make those introductions as they come. A couple of housekeeping bits. There is a sign-in sheet in the back. And if you did not sign in on the way in, please do so on the way out. What we're looking for is emails so we can be sure that we can communicate to you in timely ways. So please do that. And what we're going to do today is really kind of we want to make sure that we're kind of level setting with you, our community business partners, about COVID-19, what it is, what you need to be aware about, how you get good information about it, and then also some things to think about within your own workplaces, and then how we're handling it, so that we can work together as a team and really know what to expect from each other as we embark on this venture, we'll call it that. So that's kind of the scope of it, and at the end we'll have some question and answer time. And so given that, what I think I'd like to ask is that we hold questions to the end, and then we'll have oodles of time for questions, but that way we can be sure that we can get through the slides, okay? So you're going to go ahead and start.
Okay. Hello. My name is Meredith Burt, as Dr. McGrath said. Not standing on the side. So a little bit kind of an overview as to what COVID-19 is. It is one of the many coronaviruses. There's about 6 of them. Most of them cause the common cold kind of symptoms. This one COVID-19 is the one that's been in the media more of recently. Started in Wuhan, China, and has now become a global spread. So again, a little bit about it. The incubation period that we know right now is between 1 to 12 days. More information is coming out as we gather it, as we get more data. The mode of transmission is droplet. So you want to be concerned with things like contact with respiratory secretions, touching contaminated objects and surfaces. There is currently no antiviral treatment or vaccinations, which is where it differs with a lot of our other respiratory illnesses. So symptoms for COVID look a lot like the flu or a cold, in that they start with a fever, cough, shortness of breath, general flu-like symptoms, runny nose, fatigue, body aches, diarrhea, headache. As it advances on, where people are seeing the more severe symptoms of bronchitis, pneumonia, or acute respiratory distress. So the highest risk population at this time appears to be the elderly. The younger people, babies, do not seem to be as much affected. Right now it's 70 to 80-year-olds in that age range with comorbidities have more of a severe illness. So people with things like coronary artery disease, diabetes, and lung disease. Most people that get this, which is one of the takeaways that we want to give out, is that most people that get this have mild symptoms. So don't progress on to the severe stage. So there were a couple cases recently in New Hampshire. One was directly linked to travel to Italy. One was linked to that person. So there has been no what's called community spread. Those two were linked as far as we know. So in Vermont, these are the numbers for what we have seen in Vermont. There's been over 100 monitored, several that completed monitored, 3 tested that were negative, and no positive COVID-19 in the state of Vermont as of 6 p.m. yesterday. I make no promises about what that is right this second, as this is constantly evolving and changing. So testing is a big concern for people. And again, that is evolving and changing, even with some major changes coming out just yesterday at around noon. So the state of Vermont is equipped now to do testing in 1 location. Turnaround time is about 24 to 48 hours based on what they're telling us. Business hours, so Monday through Friday. Test kits are not readily available. There is not a huge supply, but they are starting to kind of trickle through communities. So new testing guidelines that the CDC just put out yesterday is that clinicians should use their judgment as far as testing. Ideally, we're going to rule out more common illnesses like the flu first, but it's not mandatory. So it will be a clinician judgment, so that should be a one-on-one conversation with the patient and the clinician. So therefore, what we want is to start with having people call their primary, ask, go over the symptoms. If you don't have a primary, we do have a centralized scheduling department that can help you with that. Make sure that if you're referring your staff or your employees to call their primary, some of the information that they need to have is that they're having these flu-like symptoms, particularly if there is any travel link or any contact with somebody who has a direct travel link to one of the concerned areas, say China, Italy, things like that. Or somebody obviously that has a positive test. So those are things that they should know. And if the provider does want to see them, those are things that they need to know to protect the staff coming in as well as the community around them. So patients who are acutely ill, acutely short of breath, severely ill, should be referred to our emergency department as always for evaluation. If possible, if medically appropriate, we want them to call the emergency department from their vehicle once they get here, so we can again go out and have them come in a safe, proper way to keep everybody safe and protect that patient as well as those around them.
So this is, a constantly changing situation. As Meredith said yesterday, the testing came on deck in Vermont and hadn't been available before, and the testing criteria changed yesterday as well. We expect that this is going to continue to be very dynamic, and we're going to see changes. And so one of the things that you have to think about is, what is it that you need to tell your workforce or listen to your workforce's concerns about with this? And, as Meredith pointed out, most people will get mild symptoms. So we really need to prepare and not panic. There is a lot of bad information out there. There are people who are preying on folks already. We know that. We've seen that. I went on to Amazon today to see what you could get for Clorox wipes, and you could buy a case for $500. So, it's a problem. So prepare, but don't panic. One of the really key things about this is the issues around appropriate hygiene. So frequent hand hygiene, coughing into your elbow. These seem very basic, elementary, the things you tell your kids. But the reality is that we recognize that no matter the scope of this, whether it becomes big or not, if we can temper the spread so that it's spread even more slowly, we are going to be able to manage many, many more patients in a much more readily able fashion. If we're getting them in, a reasonable trickle or a steady flow as opposed to an onslaught. So whatever we can do to kind of not just temper the spread, but also temper the pace of the spread is really important for our community. Obviously, disinfecting high-touch surfaces. Don't touch your face. It's amazing. You hear it on the news. Everybody touches their face all the time, but believe you me, I do it all the time, and I'm 100% sure that you do as well. It's a difficult thing to get over, but it actually matters because it is those mucous membranes that are really the entry points for the germs. And then, as I mentioned, the cough etiquette thing. So your workplace during this is, you have to look at it, and are your employees really encouraged to stay home if they're ill? I mean, think about your workplace culture. For your business purposes, you want to keep things rolling and keep people going. But in point of fact, if your employees are coming in sick, they may be, you have to really think about, am I, as the employer, encouraging people appropriately to stay home? It's really, for your employees' benefits, your, whoever you are working with, whether you serve the public or not, as well as as that individual's betterment, that they're staying home if they're sick. That's a hard thing. Do you have your key roles covered? We go through that all the time here. I'm sure you do as well. Again, these may be very elementary questions. You maybe already have addressed all these within your organization, but I really raise them because it's important that you do. We are depending on you actually addressing these questions appropriately in your facilities. And let's see. And do you have policies in place regarding that? It's about the culture and it's also about the policy. Then the other thing is to just really encourage folks to use readily available sources for evaluating their health. So Meredith talked about, calling primary care versus coming to the ED. One of the things that we worry about is we of course will take care of everybody who comes to our ED without exception. But we want to make sure that the folks who are coming to our ED are the folks who really need our emergency services and not the folks who just want a test, they have a fever, they have a cough, they feel lousy, they have the flu. You wouldn't typically go to the ED for the flu. You'd call your primary care office and assess what needs to happen next. And that's still true even with this. Despite all the questions around testing and concern and quarantine, that still is true because we want to be able to have the capacity to be able to take care of the very ill who really need that setting for service and no other. So the primary care telephone triage line is important. The other thing I would add is there are telehealth options. So some of you may find, if you do a little investigation in your employee health plans, that telehealth services are covered. So for example, our employee health plan includes a service called Doctor on Demand, which is a little app, goes on your phone. It's kind of slick. You push the app, they figure out what state you're in because your doctor needs to be licensed in the state that you're standing in. You might live in New Hampshire, but you're standing in Vermont, so it needs to be a Vermont doctor on the other side. And if you have an insurance plan, they'll ask you for that, and it's either covered or not. I think if it's not covered, it's like $40. It's a primary care visit kind of fee. And then they connect you with a physician who will, do an exam or, an interview by phone and kind of assess things. And I think that that's another non-exposure way of being able to have your employees access medical advice as well. And I would say that that happens to be the one that we have. So I'm just, I know that one, I'm familiar with it, I'm not stumping for it, I have no conflict of interest in it. But there are other apps as well. So, your health plan may have some opportunities with that you might take advantage of. And it could be another helpful tool because, again, there's no exposure involved for anybody else. So, really the goal is reducing exposure. And the other thing is that, as Meredith pointed out, it's the folks who have comorbidities or second diseases or second health problems that are really the most struggling with this when they get significant infections. And so to that point, struggling with the flu at the same time you're struggling with COVID-19 is not a good combination. And so it is still reasonable to get a flu shot, a flu vaccination if you haven't had one yet. So that is something else that you can tell your employees to please consider getting a flu vaccination. It will help. So what we've been doing is we have been working with folks at the state level, Department of Health, CDC, EMS, the local healthcare facilities, as well as you all here to really try to put together our plan. And we also are in touch with obviously our board of directors and our staff here. And today this education session with you all is really the start of our communications with you in many ways. So we have been doing employee education with all user emails to our staff, also assisting them in assessing what kind of work changes they need to make to be able to accommodate a flow of patients, which we are starting to see patients with worries, patients who need testing. And considerations around that. We've talked with our medical staff a few times, and looking at press releases. We also updated our website, so if you go to bmhvt.org, which is our regular website, on that first page there are some colored stars that you click to get to different pages. One of them is COVID-19. There's a ton of information there. The thing about the website is that it's important for folks to have really accurate information. As I mentioned, there's a lot of misinformation out there. This is one of those things where the news is not necessarily reporting the accurate information, unfortunately. And so having a resource that you can encourage your staff to go to and you can go to, knowing that that's going to be kind of a true north of fact, not fiction, is important. There are some websites at the end of this slide deck that are good ones. I'll tell you, we use the CDC, we use the Department of Health. Johns Hopkins has a great COVID tracker that just is, if you want to see where the cases are in relatively real time, that's kind of an interesting one. But the CDC is really an important sort of core truth for information. We have changed our triage screening processes. Initially we were saying, oh, everybody should just go to the emergency department, and then we thought through that and rejiggered our processes, realizing that no, in fact, if we want to be poised for managing potentially large number of patients, we don't know. We don't know if what's happened in China is really going to happen anywhere else or not, so we need to be prepared for that potential. And so we've changed the way that we think about our workflows and the way that we're directing patients. We've also adjusted our primary care schedules so that we have much, much more access for immediate, really short notice, same day kind of acute appointments. So that's a new thing, and we'll continue to do that more as it seems necessary so that we have really good accessibility for people to get in and see a clinician. And we have really done a lot around pandemic preparedness. This is not a pandemic at this point in time, but we are preparing should that actually come to fruition. So Taylor, this is your expertise.
So in terms of an emergency response plan, we not only have an abundance of supplies, we're maintaining a constant supply of the PPEs and making sure that we are getting the appropriate deliveries. We're not lowering or changing the amount of supplies that we are getting. On top of that, we've got a really solid plan in place to take care of these patients should they need inpatient treatment. We have multiple negative pressure rooms in both the emergency department and on the inpatient units. We also have the capability to make an entire negative pressure unit if we need to. We spent a lot of time developing a 3-phase staffing plan because with sick patients are going to come sick staff. So we need to kind of be a little creative and realize that there is staff outside of this hospital that are in our practices or our clinics that can help us take care of our community and our patients. So we're trying to be as wide lensed as we possibly can and really just focus on taking care of patients and keeping everybody's exposure down.
So the message that we really want you to take home to your workforce is, again, as I mentioned before, prepare, don't panic. Really, keeping people feeling comfortable with knowing what they need to do. As I mentioned, we're committed to providing the care that we need. So, when we're talking about where to direct patients, whether it's to the emergency department or the primary care, it's out of our abundance of caution to ensure that people are getting care at the right level. And there is a handout over here. There are a couple handouts we have that you can bring home or back to your facilities that have some information that you can pass out to your staff. Xerox them liberally at will. And then we will continue to post updates to our webpage. We're gathering your email addresses as mentioned so that we can give you information as it comes and keep you abreast of what's happening here. And then here are some of the websites, as I mentioned: the CDC, the World Health Organization, the Vermont Department of Health, and then our own webpage there. So this comes the question and answer part of the program, and we will be here until folks don't have any more questions. Yes, go ahead.
Many of these viruses are seasonal in nature, and I was curious as to what you think with respect to this particular virus. Will it follow that pattern? And if so, when do they typically start to diminish?
Excellent question. So people who didn't hear, there's a question about the seasonality. A lot of viruses have a seasonality. We have a flu season and then it ends. So we don't know the answer on this one. And Meredith, you can certainly chime in, but we don't know the answer on this one. We're hopeful that it'll be similar. Even if it's not the seasonality of the flu kind of coming down will be helpful, because as we mentioned, when people are infected with more than one thing, that increases the severity of illness. So if flu dies away, that in and of itself will be helpful. We've had a pretty robust flu season. And we also don't really know what it means come fall. So that'll kind of introduce a whole nother question about would there be any further surge in the fall? And we don't know the answer. They're working on developing vaccines. In the past, when they've developed vaccines for new viruses, they've incorporated that into the flu vaccination. But we're realistically, as fast as they can work on the vaccines, we're probably 18 months out from the development, so of it being able to be delivered to a patient. Mm-hmm.
The only other thing I would add to that is a lot of the reason that you see the seasonal aspect of things is more social distancing, as kids are out of school and people are out doing things and not cohorted so much together due to the fact that it's winter. So we may see a lull in it, as Dr. McGraw was saying, and then it come back, and that's happened with previous instances. So.
Other questions? Go ahead.
Can you offer a recommendation about getting a doctor's note to return to work if you're out for several days? And I'm wondering about someone returning to work too soon versus taxing healthcare systems.
So I'm going to repeat your question just so everybody can hear and make sure that I got it right. Your question is about how do you know when people should be coming back to work and whether they're coming back too soon. So I think there's sort of two questions in that, really. One would be for any random illness that's not COVID-19, and the other one would be if it's COVID-19. Right? So correct me if I'm wrong. Is that kind of what you're looking at? Okay. So I know what I've understood around the COVID-19 is for people to be cleared of COVID-19, and of course we're not to that point because we don't even have anybody diagnosed yet. But on the West Coast, for people to be cleared from COVID-19, they have to, when they're under quarantine, they're requiring that they have 2 consecutive negative tests with 24 hours in between. So that would be, so if somebody was out because of that, that's I expect that the Vermont Department of Public Health would use that same criteria, although it hasn't been enacted yet here. If they're homesick because they have the flu or they're cold, then they need a doctor's note. Again, I would suggest that they contact their primary care office and have that discussion there. Ailey, do you want to comment any more about that? Ailey, this is Ailey Peterson. She's the Vice President of the Medical Group and Population Health here.
So we are holding spots in our primary care practices for patients with flu-like symptoms or for patients in circumstances where if they would need to be cleared. We're holding spots for those patients to make it easy for patients to gain access to care. That is true also for patients who don't have a primary care clinician. The number that Dr. McGraw previously mentioned is a number to call, and they will not only help patients get assigned to a primary care clinician, but also help to get them an appointment in a timely manner to address their symptoms.
Could you repeat that number?
Oh, sure. You want to? Can you just zap back on the slides and that'll just keep it up there? Great. Other questions?
Yeah, I heard Dr. Francis Boyle and there's a couple other experts are saying that because this is not an influenza virus, it's a coronavirus, it's a different animal, and it won't necessarily get better when the warm weather comes. As far as being prepared, food stuff, you might have to, people might have to quarantine at home for a few weeks, store up food. It's 65 cents a can for beefaroni at Aldi's. I bought a few cases, so some water, drink water. At the dollar store, you mentioned the price gouging on some supplies. At the dollar store, I was able to get hydrogen peroxide and mist and form, and colloidal silver is another thing. Put drops of this in a baby's eye. It's safe, and silver kills all viruses. And oil of oregano is another natural. I just ordered some online.
So there is some advice about when, in terms of preparing, that you do want to have your usual things that you might have on hand if you had the flu. So you want to have some toilet paper and tissues and those kinds of things. You want to have food that you could fix for yourself when you can't really go out. So, you know, the kinds of things, like you said, you know, can of soup or whatever it is that you might want to be able to easily fix when you're sick and you can't go out. One of the nice things about, you know, I mentioned the Clorox wipes, but in point of fact, one of the handy things about this virus, if there is anything to be said in those terms, is that it's a pretty fragile virus, actually. And so soap and water, even if you can't get Clorox wipes and you can't get bleach or anything like that because people are, you know, doing crazy hoarding things, soap and water works. It's fine. It's a fragile virus. You can wash it away. So you can have confidence about that. It is not a super bug. It is just a new bug. Back of the room.
Assessed, you have a bad cough, short of breath, you need to come in and get assessed. How does it not spread in a physician's office or primary care office?
So one of the reasons for making the call is helping contain to start with. So we might meet a patient in the car and give them a mask to start with, and then take them perhaps not through the waiting room, through the regular ways of getting to that room, so that we can see them in a way that's safe for them and safe for the staff. You want to add anything else? Okay. Yes.
So if an employee, if someone in their home has this disease, should they also stay home even though they don't have it because they've been directly exposed to it?
So that's going to be guided by the Vermont Department of Health. They're the ones who are managing the quarantine issues. And so, in fact, there are people who are on it's not called quarantine, it's self-isolation. And they've been involved in helping set up the monitoring that's appropriate, the temperature taking, you know, the assessment, the phone calls, etc. So that's a public health thing rather than us here. And so what would happen is they would need to be in touch with the Department of Health. And in fact, if they were with somebody or had been exposed to somebody who tested positive, they're helping figure out who else needs to be included in just that assessment.
So if I have an employee come to me with that problem, they won't talk to their primary care doctor, they'll call the Department of Health?
Correct.
Okay.
The Department of Health will already be calling them.
Okay.
It's
Right.
a kind of a coordinated dance that they do with the Department of Health, where the Department of Health will see the contacts around them who should be also monitored, and they'll tell them the kind of risk of how much they can do
Well,
for the
physician
contacts.
initiate that, so once there's a positive, then talk to them and say who's in your household.
The Department of Health does.
The Department of Health is involved in that positive
the
test.
track.
They know.
Yeah.
Right.
They do, and then they do the tracing, tracking.
Okay.
Right.
Go ahead. You had a question?
It kind of builds on that, and I think you sort of just answered that. So if we did have an employee that either tested positive or is known to have come in contact with somebody who's positive, it would be the Department of Health as an employer that would guide us
Yes.
on how to figure out whether we need to self-monitor or self-contain
Correct.
as a whole organization.
Correct.
They would be our resource.
Yes.
Okay, thank you.
Yes.
Are there, for not-for-profits and businesses that cater to the public, established criteria yet for when it may be necessary to close a business?
So the question is, are there established criteria for when it might be necessary to close a business for businesses that have interaction with the public? And I would say that I have not seen anything specific to that. You haven't either. I think it's a good question for us to investigate and see what we can come up with. But I don't know the answer to that.
I've got a somewhat special question. We're considering going to an international conference the first week in April. And they are saying, well, we don't know whether we're going to cancel it or not. Probably not. Do we really believe this is going to snowball into being a disaster or not? Apparently, it's in Denver. They canceled a major conference this week in Denver because of it. So we're trying to decide whether it makes sense for us to consider it. Now, the specific question which is relevant to pretty much everything is what we're doing is putting things out for the public to come, pick them up, look at them, and put them down. Are we spreading just by virtue of having merchandise out so that the public can touch? That could be true in any store in Brattleboro.
So a couple of different questions there, so let me unpack. First one was about what do you think, correct me if I'm wrong, but the initial question seemed to be about what do we think about international travel? Should you go, should you not go? Is it going to happen or is it not? So I don't have any dice to roll. And it really, that's what you would kind of need. I would say that we see, obviously, travel limited in countries where there is a great deal of presence of the disease. So, you're not going to any conference in Italy, I'm betting. And it's certainly an open question on some of the others. We don't nationally have any restriction on our travel at this point in time from in an international standpoint, except for respecting some of these more high incidence countries. It's a judgment decision, but I will say that there are conferences being canceled, whether it's in an abundance of caution and it's more than necessary, or whether it's real, we don't know. I think it's too early to really predict that. So, not a hard answer on that one. It's a tough question. I see it discussed in a lot of different forums for people who are traveling internationally. The second question is, with respect to the flyers themselves, we're handing those out thinking that they're okay for anybody to read. Of course, we want to spread this information. We're handing them to you thinking you're going to turn around and hand them to your employers, not have lots of people picking them up and putting them down. So that's the flyer. The question about what about the flyers. The other piece that you mentioned is what about your merchandise? And so, I think you raise a good question. I don't have a complete answer for that. We're thinking about, what is the impact on food service, for example, and at what point in time do you not have a salad bar, and those kinds of questions which become relevant when we start seeing it. Now, mind you, of course, the incidence in Vermont, is still 0, right? So. So those are questions. Again, as I said, it's a very fragile virus. So things that can be cleaned, great, no problem, because you can wash your hands. Maybe provide some additional hand sanitizer when people come in. So if they pick something up, they're picking it up with a clean hand. I think we have to think creatively with the information we have because we don't have a full instruction booklet on every aspect of what we do in our day-to-day.
I would kind of tack on there. About the travel, the CDC is pretty good about updating their areas of concern and certainly where any travel restrictions are. So I would monitor that site certainly as it gets closer.
Yes.
And then protect yourself when you go. Wash your hands. And
one comment about masks. We didn't actually talk about masks, and there is some widespread confusion, I would say, about masks. A mask is something you wear, like surgical masks that we're used to seeing people. A mask is something you wear to protect others from you. It collects your germs that you're coughing and prevents them from spreading out. It doesn't protect you from anybody else. So I think that there's some widespread misunderstanding about that. It's not designed to be preventing you from getting any of the particulates and any of the germs that are in the air. And that's why you see, that's why there's this discussion about, the masks aren't useful, save the masks for healthcare. So if you think about, we have a sick person coming to the hospital, putting a mask on them is helpful because it contains their respiratory droplets that they're coughing out. And in the healthcare setting, we have special respirator masks that we wear that are not your generic surgical masks that are helpful for us in terms of preventing the known pathogens or those known germs from entering. But there's special masks that need some specialized fitting to be worn. So just, I think it would be helpful for us to understand that and really, continue to spread the facts about masks, and rather than having them be used up unnecessarily when they're not actually being protective.
And I also think a lot of people were seeing people in China wearing masks and getting the misconception that they're wearing them for their protection, whereas a lot of people just always wear masks in China due to other reasons.
Air quality concerns, right? Other questions? Yes, go ahead.
You mentioned that I know the test kits are there's not a whole bunch of them at this point.
Not yet.
And they're still developing some additional ones. You mentioned there's one site in Vermont that tests. Now,
yes.
I assume that's a laboratory that
yes.
tests. So I don't know how the test kit works. Could you expound on that a little bit?
Sure. So it is a specialized. It's a coronavirus, just like the common cold, but it requires a special test to identify that particular strain. So until 3-4 days ago, something like that, there were only a few places in the country that were testing, Vermont not being one of them. The CDC announced that there were going to be 80 additional test sites. We assumed that that would be probably at least one per state, plus some places with high density of population would have more. And as of yesterday, we discovered that the CDC is using a lab in Colchester to do that. So that's excellent news, but as Meredith pointed out, it's a Monday through Friday service at the moment. They run the test once a day, so they're providing some really annoying delays at this stage of the game. I think over time that will change and ramp up, but truthfully, the volume isn't there based on the numbers right now to actually make that necessary to be different right now. So the testing protocol, it's the same thing that we do as a flu swab. It's just a nasal swab. It's actually feels funny, doesn't really feel great, but it's not hard to do. And so it's a pretty straightforward test as long as you're using the right particular swab, and then it's run by that lab. Does that answer any other questions with that?
Is it like a 24-hour, 48-hour turnaround?
The test itself only takes about 5.5 hours to run, but they're running it once a day right now. So depends on when it gets there, because it has to get to Colchester. So you got a lot of logistics time involved. So realistically, somebody comes in and gets tested. It's 24 to 48 hours before we really would know the result. Mm-hmm. Other questions?
Kat, I
yes.
have a question for the owners of businesses. Let's say a person who works in the business comes in with a cough, and the business owner doesn't have any masks. I mean, I think you have the choice of either keeping the person there, if they're not too sick, recommending they go home, or having masks and making sure that person has a mask. I mean, I think this is the devil's in the detail. It's kind of hard. A lot of people have little coughs, and they probably aren't very sick. But would you recommend anything different from that?
Yeah, I don't know. Not being a business owner, we're used to seeing sick people around here. I'm not sure what you do as your protocol when you have public in your space that don't sort of match your desires of behavior. We know what we do here and what our sort of rules and regs are about that, but I don't know what that is in the public space for businesses. So maybe some of you who have thought about this might be willing to say what you have done in the past. If you've had folks in your store or shop that maybe needed to seek some medical attention, you approach them. How do your clerks handle it?
We came to you with that question. It's a difficult
Yeah.
difficult thing.
Right.
People have certain rights and
Yeah.
freedoms, and we've experienced it before this. It's like, really, you shouldn't be here. You should be out. You should go home and take care of yourself.
Well, I would say that, that's one of the things that we want to stress around here is that, number one, people are scared and worried. But number two is, we want to approach them with compassion and a can-do attitude. And yes, we want to take care of you. And so, I think, that's certainly our approach, is to start with the, we want to take care of you. We're concerned for your health rather than what you're doing to my merchandise, kind of a idea. But so that's certainly a place to start. And I don't know who else has used any other kinds of scripting with your staff. It might be helpful. We do that often with employees here. If there is a certain way we want them to manage a certain issue, we will kind of figure out what that language should be. We call it scripting. And everybody can put their little bit of twist of language on it for themselves so they're comfortable with it, but giving them the tools that they need to be able to have those discussions is important. Anybody else have some thoughts about that particular question? Go ahead.
This business of hand washing as opposed to those cleanser things.
Mm-hmm. Sure.
Somebody's in your store and they start coughing or something, you might suggest, I suppose, that they clean their hands. Here's a hand cleanser thing.
Sure.
And after they've finished, clean their hands again, because they've been touching something that somebody else has been touching. And you can say that in concern for them.
Absolutely. Yes. So using, suggesting that here's some of the hand sanitizer. Can I,
Is that as good as soap and water?
Yes.
For this, yes.
Yep. Yeah. Okay. There was one back there. Yes.
So will urgent care be providing testing as well? Do you know?
Not that we have been made aware.
Well, that's interesting.
I can't speak for them, but I haven't been told that they are.
So I wonder what if people show up there with symptoms. I wonder what urgent care is going to recommend you do.
Yeah, I think so. The question is, what's urgent care doing? And I don't think that I can give you, either one of us can give you a reliable answer that is right now. As I said, this is a very dynamic and changing process. So I think there were, there were some concerns about if patients had flu or not that they had been discussing, but I don't know what their point approach is right now. So certainly could give a call, and I apologize, and I wish I had thought of that question in advance of today, because I'd love to be able to turn around and answer that. So we can certainly get that information, but as I said, it's dynamic, so I'm not sure it holds true for a long time. So it's worth a phone call.
And as Dr. McGraw said, it was literally yesterday that the state of Vermont got testing capabilities, that they didn't have to go to the CDC to be tested. So they possibly could be in the people that will be doing it, and we just might not know yet.
Correct.
Well, it's interesting that you have to have 2 negative tests before you can return to work, and I'm wondering where the tests are being made. Typically, mass production products come from China. So
right.
That is
This is a consideration with all of the supplies for this. Yes. Right. Okay. Let's see. Yes.
I just was curious about if you have a family member who's in nursing care or independent living or assisted living care, are their protocols matched with the hospitals at all? Is there an interaction happening there, or is it separate? Everybody makes those decisions separately in terms of protocol?
So the question was, if you have a family member or a loved one that's in a nursing care or independent living or any of those kinds of facilities within our community here, do their protocols match what those are at BMH? So I'll start by just saying a number of the facilities and organizations have the same medical director that is a BMH physician. So that's helpful in trying to align these approaches and make sure that they're really what they should be. Beyond that, I think we have a couple of people here from the facilities. Does anybody want to speak up and say anything about?
We actually do match and are expected to actually be a little bit higher than the hospital at this current point.
Awesome.
We have been notified by CMS that any survey that happens from yesterday on, will be based on infection control, and the focus will be on infection control and all of your policies being in place, and as well as education and all of that. The negative pressure rooms that were mentioned, from my understanding, are not required at this point.
Correct.
So we would be identifying people, isolating them, observing them, and then basically keeping them in place. It's their home, and that's the resident-centered care is the most important part that we have now. So we would be looking at symptoms, following all of the precautions that have been out there, CMC, Health Department, CDC, and the CMS have all been putting out lots of information. And our regulations are in place. That we're actually a little bit ahead of you as far as, we actually currently, because we're a closed system, have been granted the permission to not allow people in. If someone's coughing, someone's sneezing, we can offer them a mask, or we can do an assessment and tell them they can't come in because we are a vulnerable population, which would then be being exposed.
Just for the audience's benefit, will you introduce yourself so folks know what you represent?
I'm Mark Malloy. I'm the Director of Nurses at Thompson House.
Thank you.
Yep.
Other questions? You had one.
If someone does get sick with a cold or a flu and they don't have a face mask, or you can go to the hardware stores that have paper ones for dust and stuff, but even better, any clean washcloth, make 4 little holes in the corners, take some elastic bands, you tie them together,
Yep.
through the holes.
Yep.
Ta-da.
Sure. Yep. Other questions? Yes.
You talked a lot about misinformation on the web and other places. What are some of the common things that we should discard that's clear misinformation?
A couple of the things that
Careful, because we're reiterating misinformation. So this part of the program, don't listen.
I've heard things all the way from gargling with bleach is what you have to do, to don't drink water with ice in it, or any drinks with ice in it, because warm liquids will kill all viruses. To it doesn't like temperature, so the sun will kill it. Go out in the sun. There is a scam going out. I think it's that people are calling saying they're from the World Health Organization and they need your money to support this. So it's a wide range, but it's there, and Facebook Lives.
Okay.
Right.
So just make sure you're getting your information in a good
The
spot.
reputable sources.
I truly believe that the more people are informed and educated, the less fear there will be. So that's like one of my biggest things, is making sure you're getting good, accurate, up-to-date information.
And we know with certainty that there's misinformation even on the news. So for example, the Dartmouth case, we are, well connected with the folks at Dartmouth to know the actual detailed story. And we see that they're having to reiterate things over and over because the news is putting out incorrect information, and they have to keep setting the story straight with their staff and their employees. So just even the news itself is, can be misleading.
But it doesn't hurt to take extra vitamin C anyways, in the long run.
Yes, staying healthy and taking care of yourself during this entire time is definitely a worthwhile venture. Dr. Giordolani.
Kat, I don't know if anybody saw Dr. Mark Levine's presentation today. It was around between 11 and 12. The State Health Department gave an extremely good kind of status of where we are in the state, and reiterating exactly the things you do. The basics is wash your hands and keep your hands away from your face. But he did say a couple things that were very interesting. One is that the most everybody who gets sick, as you say, really ill, has comorbidities and is usually over the age of 65. As a matter of fact, children seem to be at relatively low risk, and actually in Italy, very low risk. So that's kind of a good thing, because the regular influenza is tough on infants and small children. The other point he made is he feels that the death rate is actually about 1%. And you've got about a 1% chance, in particular, of anybody, but a 1%, but your chances are greater if you're ill. But for regular influenza, it's 1 out of 1,000. 1 out of 1,000 people who get it succumb to it.
Right.
Whereas with this illness, it's 1 out of 100 worldwide so far.
So far.
The other thing, of course, he said is that that if there's going to be Vermont people identified as having it, they're not going to be very specific about where the person is, because they don't. We're such a small state, people will get a bad rep or something. They don't want to make it. They want to keep your privacy. So you may know that people in the state are getting it, but you may not know where they're getting it, where they're living. And finally, he made the point that people who are good enough to keep themselves isolated. They just require a lot of thanks because they're really doing that for the common good. There's a lot of people sacrificing their own time and energy and are doing things for their own good. And anytime we know that someone's doing that, we should certainly thank them. And they make the point to do that.
That's great, thank you.
Thank you.
I want to go back to the point about the mortality rate or the death rate with the disease. And we've seen a lot of numbers, and it can be confusing. It's 1 in 100, it's 1 in 1,000, it's it's more than flu, it's a higher rate, it's a lower rate. And just by way of explanation, to start with, the absolute number of deaths of flu is affected by the percentage of folks who die with flu is affected by the total number of people who get flu. So the concern about this is what's the total number of people who get it. So to some extent, the percentage rate is not as important as the total absolute numbers in this instance. The other thing is that in medicine, we always look at any individual study that's done about anything and say, let's investigate and unpack that data a little bit and get into it deeply. And one of the things we have to look at is the patient population that this study is being done on, is that the same patient population as my patient population that I'm paying attention to? Because the issues and concerns and comorbidities and social customs, et cetera, in a particular population don't necessarily translate to your patient population. And so we know, for example, in China that there's a very high smoking rate, particularly among older men. So that may be completely throwing off what that mortality rate is, not for their population. It is what it is there. But we may not see that same mortality rate here because we have a different population. The mortality rate in Vermont might be different than the mortality rate in Oklahoma. We don't know. So you always have to look at your patient population. And so there are being some attempts to try to mitigate those differences in populations in some of those numbers that you're seeing. But I think it's going to mean that we're going to keep seeing different rates all over the time. And it's not that they're wrong. It's just that they're looking at different slices of it. And so the point is, wash your hands. It doesn't matter what the rate is, wash your hands, okay? And then I think you make a great point about that the quarantine is very difficult, and whatever we can do to support folks who might end up in that situation, we should do that. Other questions? What are you hearing from your employees? What are you hearing from your, the folks, whether it's your students or your employees or your customers? What concerns are they raising?
We have one employee who already has respiratory issues and is very concerned about what would happen in the event that she were to become infected with this. Because her respiratory system is compromised.
Right.
So in that particular case, we're making arrangements for her to work from home.
Excellent. That's perfect. That's really the best answer because as we talked about before, reduced exposure is really key. So that brings up a good point that we didn't actually mention, which is thinking about what of your employees actually could work from home. Because if they can work from home, then they're number one, they might be able to work even on quarantine when they're bored silly and going out of their mind, right? Number two, it also, if they can routinely work from home, they might provide you some bench depth should you have other employees who do get sick. So, and furthermore, it just protects everybody in that environment, which is really key. You had a question behind you.
Just a comment of what we're doing. I represent the school system, superintendent, so we always send sick students home, but we are now also saying if a teacher is sick, they must go home.
Good.
We're getting more calls from parents concerned, and the information is if your child is sick, keep them home. At school, we're taking precautions, cleaning high-touch areas, anything like custodians doing more, cleaning around desks, not sharing a lot of things in a classroom, but it's hard. We have had parents whose children are ill or chronically ill, and we've told those parents you need to go to your physician and take their advice.
Good, excellent. You raise a, I was going to touch my face. I'll tell you, we do it all the time. You raise another point that I meant to say, and something that you just said triggered that for me, is that one of the other things that we need to do here for our staff, and I would suggest that you need to do it as well, is to really let your folks know what you're doing. So when you're talking about you're doing extra cleaning, extra disinfecting, don't assume that your staff are just noticing that. It really, we know that when we have patients who were given the new medication, and you're going to do some education about that new medication, we have discovered over time that you have to actually say, I'm giving you this new medication, and so here's the education I'm going to give you about this new medication, right? I'm being a little facetious, but not entirely, because that kind of anchors it in their mind of, oh, I'm going to get some education about this. And then they remember. If you don't do that, we find that they don't remember that we actually told them the education around that. And so the same thing is true. If you're taking extra precautions in your environment, let your staff know. Don't assume that they're seeing that you're doing the extra disinfecting, but let them know that you're doing it, because it'll help encourage them the same. But also, I think it fosters a wider sense of we're our community trying to take care of our community, and I think we're really going to need that. Other things folks are saying or you're hearing? Yeah.
I think we have healthcare and health time. I think people are concerned about other places, especially high traffic areas in town, where people, may not, they may need to go to work because they don't have any sick time, or they may not get the test because it costs money. So there's that kind of a talk.
So the folks who don't have sick time, I think that it's important to go back. If you're an organization that doesn't have sick time, I think you need to go back and actually figure out how you're going to discuss that with staff about how they can be absent when you need them to be, because you need them to not come in when they're sick.
I wonder if the hospital is willing to kind of reach out to the larger employers in town, the grocery stores and places like that, to encourage that kind of a thing.
Gina, who did our lister for today go out to?
Mostly to chamber members.
Okay.
When all chamber members. I don't know if those organizations are chamber members.
That's right.
Okay. All right. So that's a good point that there are some others. We did try to advertise this, fairly widely. My guess is that if this increases substantially within our community, this is just the first of these opportunities to have some discussion. But so I think you raise a good point, and we can follow up with some of the other folks. Really, even if only to distribute some of the materials that we have and point them to our webpage.
Can I just reaffirm that there is more outreach, because I spoke to a couple of other large businesses in town, and their directors didn't know about this meeting. So I would please encourage you to do it again.
Yep, absolutely.
Thank you.
Okay. Carmen.
Just a suggestion as a consumer who probably would say goes to the supermarket, it would be wise that we could ask to speak to the manager and say, what is your policy? This is what's being done, and I, as a consumer,
be proactive.
would like to know
Absolutely.
how you're helping your staff. And so that's a way we can all help.
That's a great idea.
Yeah, so really being a proactive part of really encouraging that our community stay as healthy as possible by asking folks what they're doing. Yeah, I think that's a great idea. Thank you. Yes?
Hi, I'm representing Brattleboro Housing, and we actually have signs on our office doors now stating, stop if you have fever or cough, please reschedule. And we have our SASH nurse reaching out via phone.
Great. So the housing has signs, so everybody can hear, has signs posted about if you have a cough or cold, please, stop, call, reschedule, and we'll basically see you when you're healthy and can help you.
And we have our SASH nurse who actually reaches out to them via phone, so they
Correct. So the SASH program, the Seniors and Services at Home, will reach out to some of the folks at home to try to help assess the situation.
And again, maybe if, we need to start rethinking things like, do they really have to come into the office for some of these appointments? Can we do them over the phone? Can we do them through FaceTime? We have a lot of technology that we don't necessarily use in abundance that maybe we could plug in when needed.
Yes.
I have been, for the last 3 months perhaps, fighting little rhinovirus, common cold, and it's settled into my chest. It got a little bit of bronchitis, but not too much at one point, and I'm pretty much over it all.
Great.
So if we do travel and start mixing up with a larger public, what are the signs that I should really worry about, that this is not my common cold coming back a little bit, but this is actually...
You want to scoot that back. So as we mentioned earlier on, first of all, stay in touch with your primary care. So that sounds like a call to your primary care is in order. And then as we pointed out, the early stage of COVID is fever with a cough, shortness of breath, runny nose, those kinds of things, the fever being key. But again, I'm not going to stand, I am a physician, but I'm not going to give you medical advice right now aside from that. But be in touch with your physician. Other questions? Okay, well, thank you very much for coming. We really appreciate. One more, Dr. Tortolani, one more thing.
Question, just a thought. This might be, anytime you're in the flu season, whether it's the regular flu or what we're talking about here, COVID-19, it might be the time to not have the children visit the grandparents who might have a chronic illness, and just try to stay away from crowds, because the child might bring something into them. It just, phone calls might be better. If the child is in any way sick, try to stay away from
phone calls, FaceTime.
Yeah.
Right, yes. So thank you very much for coming. And, as I said, this is the only one we have planned right now. If things really progress significantly, this is likely the first. And keep an eye on our website. We will, continue to update things there, and we're happy to answer questions as they arise. So thank you very much.